Good morning, everyone, and thank you for joining us bright and early this morning for our first Wake Up with Research breakfast. We're excited about the turnout this morning. There are more than 100 of you joining us, so welcome. I know that the first 30 people to sign up for breakfast received a special Wake Up breakfast box, so we hope you're enjoying that now here in snowy Spokane. So I'm Daryl DeWald, I'm Vice President of Health Sciences for WSU, and I'm Chancellor of our WSU Health Sciences Spokane campus. So how did we get to a breakfast series? Our goal is to provide a backdrop for our community members, supporters, partners, and alumni to learn more about the research that is happening not only in our very own community, but right here on the Spokane campus. Our researchers are making important contributions in the field of COVID-19, sleep and performance, addictions, autism, cancer, aging, chronic disease, community health, health policy, neuroscience, pharmacology, rare genetic disorders. Well, the list goes on. So for us, it's very exciting to share some of our scientific leaders with you as they discover and untangle some very complex and life-changing problems that will ultimately enrich the quality of life for all of us. Remember, these researchers are committed to improving the health of their fellow citizens. Before I hand things over to Celestina, I want to acknowledge the support and sponsorship of this morning's breakfast series, Sam and Rosemary Selinger and the Selinger-Schoen Foundation. The Selinger-Schoen Foundation is a family foundation established by Sam and Rosemary Selinger. Sam is a retired cardiovascular surgeon, and Rosemary is a very active local volunteer. They are pleased to support the Wake Up with Research breakfast series as doctors, nurses, and pharmacists are at the forefront of patient care and healthcare delivery. The Selingers note that research is a discipline that enables better understanding of each step of care. It is our hope that this series will help sharpen your observation, teach you how to evaluate new ideas and protocols, and engage your curiosity. They ask the questions: is there a better way to help? What is missing and how can you fill that niche? Can you then distribute that knowledge to others? Research that all of us in some capacity can pursue throughout our lifetimes. So to Sam and Rosemary and the Selinger-Schoen Foundation, we thank you for your support and we're grateful you're joining us today. I'm now going to turn things over to our researcher in charge today. Dr. Celestina Barbosa-Leiker is the Vice Chancellor for Research at WSU Health Sciences and Associate Professor in our College of Nursing. Celestina's primary research investigates gender differences in opioid use, with an additional line of research focusing on the transition from pregnancy to parenthood in women with substance use disorders, some of which you will hear about this morning. Celestina is an elected member of the Washington State Academy of Sciences, as well as numerous professional associations, including the American Psychological Association. Her research has led to nearly 100 publications. She's also a recipient of the YWCA Women of Achievement Award. So I hand it over to my close colleague, Celestina.
Thanks so much, Daryl, and thank you all for joining us this morning. Thank you for waking up with research with us this morning. My hope is by the end of this morning that you'll have a better understanding of all of the great research that's going on, not only across the state of Washington, but here locally in Spokane. And today we're going to focus on the topic of COVID-19. It's on everyone's mind, so we wanted to kick off this series with that topic. Before I hand it over to Dr. John Roll to talk about all of the COVID-19 research going on across the entire WSU system and here on the Health Sciences Spokane campus, I first wanted to share two efforts that WSU is contributing to related to the pandemic. The first one is on COVID-19 testing. And so across the Spokane and Pullman campuses, WSU has tested almost 9,000 students, staff, and faculty. So we're really glad that we're able to do that. We're able to offer that to our students, staff, and faculty, and we're able to make sure that everyone engaging in our WSU communities are safe. The other piece that is so exciting, you can see there in the pictures, is that we are working closely with COVID-19 vaccine plans with Whitman and Spokane counties. We're lending our expertise statewide. We have ultra cold storage. We're helping advise across the region on health disparities in our most vulnerable communities. And as you can see there, we've had more than 100 students to date helping to vaccinate and administer the COVID-19 vaccine throughout the region. It's great to see those pictures. It's great to see our students in action. So now I'm going to send things over to John Roll. I know many of you out there already know John, but for those of you that don't, John is the Vice Dean of Research in the College of Medicine. And Associate Vice President for Strategic Initiatives for WSU Health Sciences. He's enjoyed faculty appointments in WSU departments and colleges such as medicine, psychology, nursing, neuroscience, prevention science, nutrition and exercise physiology, and health policy administration. He was appointed by Washington State Governor Gregoire as Vice Chair of the Governor's Council on Substance Abuse and as an Executive Commissioner on the Eastern State Hospital Advisory Board. John has published nearly 200 publications and has been cited over 7,000 times. He is internationally recognized for his work on addiction and has been continuously funded by the National Institutes of Health for over 25 years. He is a fellow of 5 major scientific societies and is an elected member of the Washington State Academy of Sciences. So it's my pleasure to welcome John Roll. Thanks.
Thank you, Celestina. Good morning, everyone. Well, I have a pretty daunting task today to talk about all of this research, so I'm going to jump right into it. Shortly after the pandemic reached us, we, like other researchers, had to drastically and rapidly change how we engaged in our research to not only protect ourselves, but to protect the communities in which we work. Since Washington State University is a distributed system across the state of Washington with global research and faculty on the ground throughout the world, this was actually quite a complicated endeavor. We initially decided not to pause research that was crucial, and this was in close partnership with state and federal agencies. That included research that, say, was in the last 5 days of a, pardon me, of a 6-month protocol. We couldn't stop that. Or research that was directly related to COVID. Those continued, but everything else paused. I'm sorry, early morning for me. I apologize for that. As someone who has spent most of his life conducting and supporting biomedical research, when that pause happened, it was eerie. Everything went quiet. But almost immediately, we began devising protocols to safely resume our work in close coordination with federal and state partners again. With the judicious use of personal protective equipment, social distancing, and changes to the physical environment, we were relatively quickly able to get our basic scientists back in their laboratories. We still have a large portion of our clinical researchers who are unable to resume their work even today. But we are beginning to re-engage those teams who are engaged in therapeutic efforts, again, by limiting exposure time, judicious use of personal protective equipment, and social distancing. During the slowdown, our faculty were busy analyzing data, collecting data remotely, writing manuscripts, and writing grants. In fact, our faculty have submitted over $49 million of grants to support COVID work, and they've received over $27 million of grants. This doesn't even include the CARES funding we've received. We did encourage our faculty to pivot to COVID research if it made sense for their particular situation, but we didn't want them to neglect or abandon their pre-pandemic work because a major source of revenue to our state and an economic driver is the research enterprise, and we want to maintain that capacity. In the few minutes I have with you today, I want to share with you some of the breadth of the research our colleagues have published on COVID or the pandemic. As you all know, COVID has impacted many aspects of our lives. In fact, I'm coming to you from the 8th day of a quarantine in my basement at home, so it reaches all of us. The research I'm going to share spans all the colleges and campuses in the WSU system. It talks about the various aspects of COVID that has impacted our lives, and it highlights the diversity of our faculty expertise. We've had about 60 papers published to date, and I can only highlight a few of these, obviously. To my faculty friends who may be in the audience, I want to apologize if I exclude you. I'll get you next time, I promise. Let me start off talking about the work Dr. Glenn Duncan's team has done. Dr. Duncan utilizes the Washington State Twin Registry. This is a program that he runs. He's published several studies with his group looking at how COVID responses have led to a decrease in physical activity and increased stress and anxiety. They've also looked at how relationships between fear related to COVID and depression arise, and they've looked at how people have been turning to alcohol to try to cope with these COVID-induced negative reactions. Dr. Eric Lofgren in the Allen School of Global Animal Health has done important work on modeling the spread of COVID in hospital settings, in sporting arenas, and in jails. This work has been influential in guiding relevant decisions. The teams of Dr. Amiri, Monsivais, Lutz, and Amram have published considerable work that maps the vulnerability to COVID, revealing the sad fact that COVID exacerbates existing forms of racial and economic disparity. Dr. Lee and Waters have looked directly at Asian and Asian American experiences of discrimination during the pandemic, and a number of our faculty have looked at the social aspects of the pandemic, including Dr. Park's work on group dynamics, Dr. Probst and colleagues' work on economic stressors, and Dr. Lanigan and her colleagues' work on the challenges working and health behavior interactions have posed for us all. As you might expect, we've also published a considerable amount on the medical management of COVID. This includes work by Dr. Roberts on ICU bed shortages. It includes work by Dr. McPherson and his colleagues on how to model COVID surge capacity in hospital systems. It includes work by Dr. May looking at the allocation of scarce medical resources. The work of Dr. Robinson highlighting the role of community pharmacies in COVID management, and the work of Dr. Graves looking at specific issues of telehealth use in the COVID pandemic. Our foundational scientists have always been busy, and they've continued to be busy in the COVID time. Dr. Letko, who joined us early on in the pandemic and is actually an expert in COVID type issues, has published considerable work, including a functional assessment of cell entry and receptor usage for SARS-CoV-2 and other lineage B beta coronaviruses. He's published another one on bat-borne virus diversity, spillover, and emergence. Dr. Njinga, one of our colleagues in our Nairobi offices, has published on low morbidity and mortality of COVID-19 in Africa. Dr. Liu in the College of Medicine has looked at alterations in serum markers in COVID-19 and mortality. COVID has also had major impacts on how we deliver and receive education across the lifespan. Our faculty have addressed this through a number of publications, including work by Dr. Lupili looking at distance educational programs for international students, Dr. Strang and McMain looking at social emotional learning, Dr. Graves' look on the on the impacts of school closures, and Dr. DeWitt's important work on the role of COVID limitations on medical student internships. We also have a vibrant group of researchers in the Criminal Justice Department and sociology working on and publishing on how COVID issues impact jail and prison situations. COVID also has a major impact on businesses and economic situations. We've had work published on restaurant and hotel customer satisfaction, impacts on the hospitality industry, work on the risk perception in oil and gasoline markets, important work on labor issues and food chain supplies in COVID. I think you'll see a lot more of this work coming out of WSU as our land grant mission. Our partnerships with agriculture and veterinary medicine make food chain and food production crucial issues. Finally, Drs. Bowles, Austin, May, and McPherson have published and continue to have a vibrant program looking at vaccine hesitancy. Based on grants received, I think you'll likely see forthcoming research from Dr. Bose published on host-driven therapeutics for COVID-19, Dr. Amram and colleagues on deferred healthcare, I think this is going to be an incredibly important area for us to understand. How does all the healthcare we haven't received while we've been sheltering in response to the pandemic, what will the impacts of that be in the years to come? Dr. Kaimi Sinclair has received large funding from NIH to study COVID-19 in Marshallese populations. There's work ongoing in engineering to develop sensors for COVID monitoring. Dr. Buchwald has received generous funding from the National Institutes of Health to devise systems for testing in reservation settings. At WSU, we have something called the Laboratory for Atmospheric Research. I think it's a real crown jewel in our system. These faculty study how viruses, among other things, spread throughout the air we breathe. They also look at things in partnership with folks like Dr. Postma about how wildfire smoke may exacerbate these exposures. Very exciting work. And as I think you all know, COVID has had a major impact on addiction and health behaviors. And we have vibrant teams of researchers across the system and colleges looking at this. And you'll see publications forthcoming on addictions and COVID soon. Our faculty have been very busy. As always, I'm always so proud to be associated with such a great group of colleagues. It makes my job hardly even working. And I've just shared the tip of the iceberg today. There's so much more going on. Moving forward, I think we'll see increased work on long-term impacts of COVID. We recently received funding in the Allen School for a new center focused on West Africa and emerging zoonotic diseases or threats. This is only one of 10 funded in the entire country. Finally, the last thing I'll talk about is Dr. Elisa Swartz in the College of Arts and Sciences, and a little bit me, have partnered with Los Alamos. This is a brand new partnership to do some more sophisticated modeling where we really insert behavioral parameters into the modeling that we're doing to understand COVID spread. So I think you can see we have a pretty broad swath here. It's been a pleasure to share a little bit of this with you today. Those of you who know me know I would like to have all of these faculty here and have about a 3-day symposium where they could each give you about a half hour to 40 minutes on their papers. But the researcher in charge told me I had 10 minutes. So with that in mind, I'm going to wrap my segment up and throw it over to my good friend and colleague, Celestina, who's going to talk a little bit in more detail about a specific area of research related to pregnancy and COVID. Thanks so much for your time, and it's a pleasure to be with you all this morning.
Thank you so much, John. That was such a great overview of all the COVID-19 research going on across the entire WSU system, and of course, highlighting the work being done locally on the Spokane campus. It's my honor today to be able to share with you a study that a group of researchers and I carried out very quickly early on in the pandemic. And this is on stress, coping, and resources needed during the COVID-19 pandemic in a sample of pregnant and parenting women. This was funded internally through WSU, so we were very thankful to already have funding in place in order to move really quickly into this line of work. So as John was saying, early on during the pandemic, human subjects research, stopped. We couldn't bring in the pregnant and new moms into our labs. We typically have them there in person. We see them engaging with their baby. We talk to them. We do survey research with them, and we weren't able to do that because it wasn't safe. And so we were kind of stuck for about a week. We weren't sure how we were going to engage with our research, but we knew very early on that pregnant and parenting women and their families were immediately being really stressed, a lot of stressors and strains early on in the pandemic right away. Their worlds really changed. And so what we wanted to do was pull together a group of many researchers, probably about 9 of us across the entire WSU system, to come together to create a WSU COVID Infant, Maternal, and Family Health Collaborative, so that we can study right away the impacts of the pandemic on families. And so that's what we did. So as you see here, we have 2 studies. They are under review for publication. So you'll just see some preliminary results from the first study where we looked at the stress and coping. But we also have work led by Dr. Crystal Smith in the College of Medicine looking at substance use in pregnant during the COVID-19 pandemic. This work just across these 2 studies, and within this collaborative, we have a lot of different studies. These are just 2 that I'm highlighting. This involves researchers from the College of Medicine, from the Elson S. Floyd College, from the College of Nursing, from the College of Medicine, from the College of Agriculture, Human and Natural Resource Sciences, and the College of Arts and Sciences. And this includes researchers across the Pullman, Spokane, and Vancouver campuses. So we really did pull together. I'm sure our future studies will engage even more colleges and all of our campuses system-wide. So let's talk a little bit about pregnancy during the pandemic. So since that pandemic, we saw that pregnant and parenting women experienced this psychological stress due to things that had immediately changed. The first one we heard about, and I'm sure you heard about this in the media, all the popular media was covering this, was the changes in labor and delivery hospital policies. So all of a sudden, a woman that was pregnant was, ready to deliver her baby, and spouses or partners were not allowed to be in there. Maybe she had planned to have her mom there with her. All of that was stopped. And so it was really difficult, as you'll see in some of our data, that this was a huge stressor to pregnant women. We also saw a large amount of stress on the possible transmission of COVID-19 from mom to fetus and from mom to baby. Our participants were really stressed about this, really worried that they were going to contract COVID when they went into the hospital to deliver, and that they were going to pass that on to the baby. And as you see in the third point, if that happens, what are the clinical maternal and infant outcomes? What will happen to mom and baby if they do get COVID? And what we're hearing from our participants was that they would express these concerns, and they were told by healthcare providers, of course, we don't know. We don't have those answers. We don't know what will happen to you or your baby should you contract COVID. So these are a lot of stressors on top of the stressors that everybody throughout the world has been experiencing during the pandemic. So the isolation, the financial strain that you'll hear about, all of these stressors are on top of that. The reason why we're so concerned about this is because any stress that a pregnant woman has during pregnancy, that gets to the fetus. So when a woman is stressed, that actually impacts fetal growth, and that actually impacts the development of the baby over time. And so this is why we wanted to study this topic straight away, right as everything was shut down, because we knew that this pandemic was going to be long lasting. There would be downstream effects, but we were really concerned about the next generation. How is this going to impact the next generation? So let's talk a little bit then about the methods. What did we do research-wise? So we surveyed across the nation 162 women. Some were pregnant and some were postpartum. And you can see the dates there that we collected this data. So towards the end of April through the end of June, we wanted to capture women's experiences. We asked them open-ended questions about their stress and what they needed during the COVID-19 pandemic. And so they just typed away. It was open-ended, and they could just tell us in their own words exactly what they were stressed about. We also asked demographic information, and you'll see some results on that. And then we gave them a survey from the CDC. And so what was really great about this design is we were able to do statistics on the survey data. So that's the regression analyses I have down there below. But we were also able to do qualitative analyses. And that's where we get to analyze the words that the women were telling us. So they typed in how they were feeling, and we used an analytic procedure to be able to analyze that. And so when you have quantitative data and you have this qualitative data, you get to do two things. You get to have statistics that you can report on, and you also get to talk about their stories. When you have both together, that's called mixed methods research, and that's what we were able to do here. And to me, it's so powerful. Not only do you get to have the statistics, so that you can look at comparisons, but you also get to hear straight from the women themselves. And you'll be able to see that in the results here. So let's talk about some results then. Right away, we saw that 25% missed prenatal appointments. So a quarter of our sample wasn't able to go to a prenatal appointment. And to us, that's really concerning, because we know the healthiest thing, the best thing that you can do when you're pregnant is go to prenatal appointments. That keeps you and your baby healthy and safe. And so we saw a quarter of our women right away weren't able to do that. However, 36% reported using telemedicine, probably for the first time really during these prenatal appointments. And while that's encouraging that we are able to use those things, we do know that there's disparities in who has access to broadband and, laptops and smartphones and things like that. So this is, it's concerning that we would have to rely solely on telemedicine. Obviously, not the perfect situation either. We did see that pregnant women were less likely to engage in healthy stress coping behaviors than postpartum women. And that was quite surprising to us. We weren't quite sure why. I think it's because women were quite concerned about, or pregnant women were quite concerned about the what ifs involved during that labor and delivery process. And so they just seemed more stressed than postpartum women. And exactly what John Rule was just talking about, these health disparities being exacerbated during the pandemic, we saw the same thing in our study. We saw that women of color and women with lower incomes were more likely to report serious financial problems compared to non-Hispanic white women and women with higher incomes. So that financial strain that everyone has been feeling, it was even exacerbated even more in women of color and women with lower incomes. What else did we see? We saw that women with higher incomes, women that were not on Medicaid, so had private insurance through their work, and non-Hispanic white women reported more social support. So they felt that they had more of a social network, friends and family to rely on. They had more financial resources as well, and they had a better sense of belonging to their community compared to women with lower incomes, women on Medicaid, and women of color. We wanted to look at social support or these types of support because we know when you're feeling stressed, the best way to buffer that stress is to have this social support system around you. And so we see, again, these health disparities that have been exacerbated during the COVID-19 pandemic, even with our social support networks. So when it comes to primary stressors that we heard from our women, the number one, concern was the baby contracted COVID-19. That was their main concern, quickly followed by their self or their partners contracting COVID-19. A lot of the moms talked about this fear of, if I get COVID-19 or my baby gets COVID-19, I'm going to be forced in the hospital to isolate for my baby. That was a big stressor from pregnant women. Should one of them contract COVID, because they know the importance of that infant maternal bond that happens right away. So the thought of having to isolate for a couple of weeks was really weighing heavily on their minds. They also noted a whole lot about this lack of social support, not seeing family, not seeing friends, not seeing other new moms, and being able to engage in those things that they thought they were going to be able to. They also talked about family missing the key appointments. So, going to that 20-week ultrasound appointment where you find out if you're having a boy or a girl and they're having to go alone now and not having their partner there with them, or their partner not being there at the birth, at the delivery of their baby. They also talked about their baby entering a new world, a world that they weren't anticipating for or planning for. And we also saw a whole lot on finances and resources, being terrified that they weren't going to be able to afford to feed their baby, to care or support for their newborn now during the pandemic. So let's actually see what the women said. So one participant said, I think this sums it up perfectly, I was afraid to die and leave my baby behind. That is exactly what we were hearing from almost all of our participants. Another participant said, I'm worried that my husband and I won't have enough money to support our baby. So that financial strain that we talked about. Another participant said, I'm most worried about the world around us changing so drastically that I can't give my baby the life I had planned on. There was a lot of sense of these dashed hopes and dreams really for this first year of their baby's lives. So we also heard about the lack of resources. So one participant said, I had a hard time getting diapers, formula, wipes, and other nursing and pumping supplies. And so we heard a lot from our moms about, I'm sure we all early on went to the grocery store and saw empty shelves. Well, imagine being a brand new mom and not having any diapers or formula to feed your baby. That was a huge concern of our postpartum moms. Another participant said support groups, finances, support from work to care for a child, safe childcare options, or longer time to stay at home with child. So a lot of our new moms It wasn't their first baby. So they had other kids at home and they were having to consider, do I send my child to daycare and potentially expose the risk of COVID to my newborn, or how do I manage all of this now? A lot of our participants were healthcare workers and they had to go back to work into highly exposed areas, and they were very concerned about that. So what can I do? We talk about here some of these issues that participants had talked about. It's impossible to know when to let my family and friends safely visit and meet my baby. This is a really big, this was a really big stressor that women talked about. They were really concerned about offending family members, about not knowing how safe it was going to be for their parents to come and hold the baby for the first time and things like that. Another participant talked about, I worry most about not seeing my family members and not getting to be present at baby milestones. So not having grandparents around, not having their best friends around, neighbors to see the baby, things like that. Knowing that, they're going into maybe a year or longer with wanting to keep grandparents safe and free from COVID and not wanting to pass COVID along to grandparents, but knowing that grandparents are missing these really key milestones of the baby. That was weighing really heavily on our participants. Another quote that we have here was asking for communication guides for talking to family about not holding or meeting the baby. Again, really not wanting to offend family members and things like that. And I share this all with you because I'm sure many of you out there have had, births in your family or coworkers or friends or neighbors. And so I wanted to share these with you here. Another participant said, lack of public understanding of the severity in the pandemic and not taking necessary precautions to protect the general public. So in what can we all do? Some takeaway points from this study really is to, if you have, pregnant women or new families in your lives in any capacity, reach out to them, offer them support safely at a distance, virtually call them, check in on them, try to do everything that you can to, alleviate any of their stressors or concerns. Know that if they're isolating and trying to stay away from others, it's because they want to keep their babies free from COVID. They're terrified of them contracting COVID or themselves getting COVID and having to isolate from their newborn. They don't want, baby or themselves to give COVID onto grandparents or others that might be more vulnerable. They're trying to manage that all while being a new parent, and it's a lot for them. So I share that all with you. I really love that last quote with just really taking the necessary precautions to protect the general public, knowing that there's additional vulnerable populations. We all want to keep newborns safe. And so I really was glad that I could share that quote with you there. So partnering for better health. We would, of course, want to partner with all of you to increase the health and well-being of every resident of the state of Washington. That is our land grant mission. At Washington State University, we're a land grant university, and our goal on the Health Sciences campus is to help increase the health and well-being of every resident in the state of Washington. So we would love to partner with all of you on the research that we do, really just trying to help decrease health disparities, help improve the lives of those that are underserved throughout our state, and really be able to just reach every resident in the state of Washington with our research. If you want to partner with us, you see the contact information there for Brooke below. And I'm hoping that with all of the work that you've heard from John and I about the COVID-19 research, that we can continue to be great partners and really try and address any type of health disparities across the state of Washington. So with that, I'd like to send it over to Kim.
Good morning, everybody. It's Kim Papich here, Director of Communications for WSU Health Sciences. It is currently snowing outside my window, and I came to work and it was still dark out, so that's real exciting. Daryl, I see that you're still on with us, but as per your usual, I believe you're triple and quadruple booked this morning. So before we lose you, I wanted to pose one question to you, and that came in on the chat. What at the end of this breakfast are you hoping stands out to the people that joined us this morning?
Thanks, Kim, but let me issue some thanks and appreciation to my colleagues, servant leaders, John Roll, who talked about the breadth of the research that is going on at WSU, committed to helping our citizens, and then to my great colleague, Dr. Barbosa-Leiker, who really touched on an important research area. She gave you kind of an overview of some of the findings, that we've all been affected by the pandemic, Kim. And what I want people to understand is we appreciate their participation, and we want them to be knowledgeable about the things that we're doing to serve them, so there actually can be a greater impact across our society. So I want to say thanks to folks for participating. We still have almost 100 people. And you know what? I know you're all very busy, but it's super cool that you were here for the inaugural Wake Up Research Breakfast. And it's pretty dang cool. So I'm going to say thank you to folks. Please come back, because we are here to serve you with our research. So thanks, Kim, very much, and appreciate you very much.
Thanks, Daryl. All right, John Roll. Jeff Phillips asked a really important question, and it's something I'd love to hear more about too. Have we seen our local health departments or health districts utilizing our outstanding research in executing their COVID education or vaccination plans?
Thanks, Kim. Thanks, Jeff. Glad you could attend today. And absolutely, the answer is yes. We interact closely with many of our regional health districts throughout our state, as well as our state level partners in these areas, and as well as national and frankly, international. I'm aware some of our surge capacity work was used in Brazil during the early days of the pandemic. So the answer is an unqualified yes. I think it's sort of built into the DNA of Washington State University and our land-based mission, that our work, while we love to do scientific work to understand how nature works, we also want that work to be actionable and of use to the people in our communities. So it's a great bidirectional partnership. We work with partners throughout the state to make sure that we understand the needs they have, and that we can bring solutions that they may be able to implement to address those.
Great, thanks, John. Celestina, back to you, something specific to the information you provided this morning. Dr. Denton over in our College of Pharmacy was wondering more about the earliest point in pregnancy in which COVID can be spread to the fetus. And then kind of from a higher level, what is your take on, do you think pregnancy rates during COVID are going to increase, decrease? And how does that play into rates of quarantine and the fetus?
Sure, great. Thank you. Thanks, Travis, for those great questions as well. So we have limited research on COVID-19 transmission. We have great research going on in throughout our WSU system right now. Looking at that, we do know, if we look at flu, that data will tell us that, there might not be a higher risk, but we really don't know yet for COVID-19. And we wouldn't know actually either how early that transmission could occur just yet. Usually we know, the babies are tested right at delivery right away. Interestingly, we have reports early on that we are expecting increase in birth rates during this time. So I think that we'll see, a larger cohort, I think, of babies being born. And so really, that's, really the main reason why we're wanting to do the research that we're doing, so that we can help provide this evidence to healthcare providers, so that during those OB appointments that they can be talking with women and working with women to really decrease those stressors, so that it's not impacting fetal development and child development over time.
Great. And since we're still talking about your study a little bit and this impacted population, was there any follow-up support provided to participants in the study?
Follow-up support that they noted from their healthcare providers?
I think from the lens of WSU Health Sciences, but yeah, any resources that you know about that were offered.
Yeah, sure. So the second study that I didn't spend time on today, led by Dr. Smith, she actually it was a longitudinal study, so she was able to collect waves of data to look at social support and look at mental health. And look at, the focus on that survey was on looking at any changes in substance use during the pandemic. And we have seen an increase in substance use. And so with all of our studies, as it relates to substance use, we're always offering services, psychological support, counseling, things like that across any of our studies to our participants. What we noted in our study was that almost every participant was talking continuously to their healthcare provider over concerns about the COVID-19 pandemic. So they are reaching out. They said it was a focus of almost every prenatal appointment to be asking these questions. And of course, rightfully so, feeling their stress wasn't completely alleviated because healthcare providers have to say a whole lot of, we don't know right now. We don't know right now. We don't know about how early, a baby can contract COVID and, a fetus can contract COVID, during the gestation, things like that. But they are reaching out and engaging with healthcare providers about their concerns.
Great, thank you. Back to you, Dr. Roll. We were going back and forth with Michelle Armstrong over in our SP3 Northwest incubator. And she, of course, has questions about, in your long list of research that you cited, what stands out to you in terms of what could be best applied to the community through entrepreneurship and commercialization?
Well, thanks. That's an intriguing question. I think the work coming out of the College of Engineering on remote monitoring, on developing sensors to detect COVID certainly has applicability. I didn't have a chance to talk about it, but there's some ongoing work, a partnership among several groups to develop enhanced personal protective equipment that has some potential. There's also surface applications you can do that will maybe help things like aircraft carriers not become contaminated early on in the pandemic. So I think those are all opportunities. I think some of the modeling potentially could be commercialized. I'm thinking particularly of the surge capacity modeling. And you never know what's going to come out next. I guess I would say I'm always surprised by our faculty's creativity and love working with our entrepreneurial coaches.
Awesome, and a good time for us to put in a plug for our Wake Up with Research on March 24th, where we're going to cover how researchers have parlayed some of their ideas into actual companies and products, and so that is going to be very exciting. I can also put in an additional plug through my next question for our February event, which I believe is the 26th, the last Wednesday in February, where we're going to be covering COVID again, but we're going to talk about impacts to vulnerable populations. And that parlays really well into a question that I want to give to Celestina. Glad to see such depth of attention given to the social determinants of illness. And can you talk more about targeted research being done to study the impact of COVID upon our local tribal neighbors here in the region?
Yes, great. Thanks for that question, Kim. That's a great question. We have a lot of tribal partners and researchers that have dedicated their lives, I would say, to working with our tribal partners on their research. Quickly, it comes to mind is our iReach folks and the work that they're doing really nationwide and locally on these topics of COVID-19 with tribal populations. We know that Dr. Lonnie Nelson in the College of Nursing and in iReach, sat on a national board to look at best practices to engage with tribal communities for vaccine dissemination, really leaning into this Dr. Deidre Buchwald, and all of her colleagues are also focusing on this nationwide to look at not only vaccine, but COVID-19 testing and how to increase testing efforts, beliefs and attitudes all around that. We are working, through our health districts locally to partner, and we have a whole lot of desire to do everything we can across all vulnerable populations, all communities of color across our state, to look at best ways to get the vaccine out there. I don't think that we can just rely on, standard practices of, to engage in communities for vaccine dissemination. I think we need to go there. We need to work with our key stakeholders across the state that are even better experts than we are. People from these communities, hear from them in order to really serve, locally and regionally.
Great, thanks. All right, I'm going to let you two duke it out in terms of which one of you feels like you're better equipped to answer this one. And I have a feeling that you both have some expertise here. But in lumping together a couple questions here, people are wondering about how our healthcare providers are doing and their experiences providing care during the pandemic. For example, Celestina dealing with all the uncertainty and worries that pregnant mothers have. And then also talking about relative risk information for clinicians and how they inform patients in the community and help ease anxiety. So I'll let you two battle that one out.
I'm happy to start, John, if that's okay. That's such a great question. I think many of us are very concerned about fatigue, emotional fatigue, just burnout, the long hours of our healthcare providers. I know early on there was research looking at the mental health of our healthcare providers. That is something that we need to continue to focus on and to track. Big concerns about that. Their safety, they have their own families. In our study, we had pregnant women that had all these concerns and their healthcare providers helping to treat patients. So yes, a lot of research needs to continue to be done so that we can help take care of our healthcare providers so that they can continue to take care of us. I would love to see as many as continued, increased efforts on this topic. Absolutely.
Yeah, I'm not really sure I could add too much to what Celestina just said, but as an academic, I will try. I think our deferred healthcare work that I mentioned will shed some light on that as well, because we've been dealing with a crisis, an acute crisis with the pandemic, and our colleagues who are providers are soon going to have to be dealing with all the deferred healthcare issues as well. And for those of you on this virtual meeting who are providers, I just want to say how tremendously impressed I have been with you and the grace and the courage you've shown in addressing this. And it's such a pleasure to be, part of a group of scholars who are providers, educators, and researchers. As a researcher, I sometimes don't see what the clinicians amongst us are doing, but I have seen it and I have been very, very impressed. So thank you.
I have another question coming in that has to do with substance use. And I feel like people are looking at our playbook, Celestina, as you and I have been talking about future subjects and areas that people want to hear more about. I know you and I had talked about that substance use as it relates to COVID and the pandemic would probably be something that would come up. So maybe that's what we'll look forward to April. In the meantime, can you talk more about what drugs you think will mostly be misused? Can we assume easier to get addictive substances such as alcohol, tobacco, marijuana may go up, or will folks be seeking harder drugs? And John, I know you of course have a lot of expertise in this area too.
Yeah, that's a great question. I can tell you with the findings of our studies with pregnant women, it was mostly cannabis. That's what was driving it. So I don't know statewide if we can say for sure it's kind of the legal substances and tobacco, alcohol, and cannabis, but that would be my guess. I'm curious if John agrees or disagrees.
Yeah, I think it's always easier to get legal substances, right? But I do think we're seeing spikes in opioid use, methamphetamine use. These are trends that were happening pre-pandemic and I think have been exacerbated post-pandemic or during the pandemic. I look forward to post-pandemic time. It's a little bit harder to see how you're going to go out when you're quarantined and get some of these illegal drugs, but I'm pretty sure that people have figured this out. So unfortunately, I think it will be all drugs, and some of these drugs are very, very dangerous. And when used alone in isolated fashion, the results can be measured in lives lost. So.
And to add to that, Kim, we do know nationally that substance use treatment has taken a hit, like many other forms of treatment for other issues, not having face-to-face access to substance use treatment, facilities having to close down, things like that. We do know that the substance use disorders are, increasing, and those with a substance use disorder are even more vulnerable, and we're quite concerned about the impact of the pandemic on top of this condition that they had going into it.
And because of that, exactly, it appears that we're seeing greater rates of death from substance use during this calendar year, although those data haven't been locked down.
Great. As we get down into the final minutes of our breakfast this morning, I want to pose the same question to both of you. And actually, maybe it's a series of questions, but I'm curious about, specific to this pandemic, what's keeping you up at night as researchers? So I'd also like a tone of optimism. So to add to that, what do you have hope about? And where do you think that that'll take research around COVID in the future?
Would you like me to go first on that one? Celestina, it'll be my pleasure.
Okay.
What keeps me up at night? I'm generally a pretty sound sleeper, but I am concerned about what the long-term impacts on research will be. How are we going to do research in the future? I think it's a little naive to think we will go back to the way things were pre-pandemic. We may find more pragmatic ways to do things, and that will be good, but we may also lose some things. One thing I'm particularly worried about is the lack of interaction between scholars from diverse disciplines. Even though I shared with you an array of work today, I miss being in my office where I haven't been since March 2nd and running into my colleagues in different disciplines in the hall and just having a chat about what they're doing. That spawns so many novel, new ways of thinking about the world in research. And I'm afraid we've lost that, and I hope we can get that back. The thing that gives me the most optimism, we're a resilient lot, we humans, and especially our kids. I know our kids have taken a beating in this pandemic, their mental health, their social health, but our kids are generally fairly resilient. And when I see the young people who are finding new ways to engage with the world, it does give me hope that some old guy like me, maybe it's going to be tough for me to figure that out. But 18 to 25-year-olds, they've already figured it out and are moving on. So I do have a fair amount of optimism that while things will be different, things will still be good.
Great, thanks, John. I think for me, Kim, that's such a good question. I do think about things in the middle of the night. I am kept up. Not so much though about the research piece, although I think there's always a way that research can assist. But my biggest concern right now is knowing across our state that communities of color, that people of color have a much higher death rate compared to white residents in the state of Washington. So what I tend to think about in the middle of the night is how can we get the vaccination to Black, Hispanic, Native Hawaiian, and other Pacific Islander and American Indian residents in our state. And what can we do? How can we act now so that they have access to vaccine, and not just access, but how can we work with the communities in order to protect them so that they have the same ability to survive should they get COVID as other residents in the state of Washington. And I think though, This presents a great opportunity for WSU to use our expertise. We study and we research health disparities. This is what we do. This is what we're committed to. This was the foundation of our College of Medicine, of our Health Sciences campus, of really the entire university is a land grant university. And so I think we're positioned to help play a key role and really very quickly be able to save lives across our state of Washington. So that's what keeps me up at night, but it's also what I'm most optimistic about, that we can really play a big role in that space alongside our communities.
Celestina, you're a communicator at heart. Both of you are. All right, so that wraps things up for us this morning. I know we've had questions from quite a few of you if you'll be able to access the recording after this morning. And yes, we'll have that posted to our website at spokane.wsu.edu. So you're welcome to access the recording there. Again, a big thank you to our sponsors. Let's put up the slide again to see what's next for our upcoming events. Wake Up Research Breakfast on February 24th at 7:30, again through Zoom. The format for that one will be a little different. We're going to change up the format each time. That one's going to be interview style with several panelists and experts from across our research endeavors that have to do with COVID and vulnerable populations. Then in March, like we said, we'll be touching on our research in regards to economic development and research entrepreneurism. So with that, thank you again, and look forward to sending you invites for our next breakfast, and stay healthy and safe.